to talk about the epidural hematoma, subdural hematoma, and subarachnoid hemorrhage. So first of all, we must have to know what is hematoma. So please remember, hematoma, it is a collection of blood in a cavity is known as hematoma. Okay, so this is the definition of hematoma. So whenever patient comes to you with road traffic accidents and having head traumas, please remember, first thing what you must have to remember, that the investigation of choice will be non-contrast CT scan. So this is your first MCQ which you must have to remember. So a patient comes to you with head trauma, so it can be patient of epidural hematoma, it can be patient of subdural hematoma, it can be patient of subarachnoid hemorrhage, or it can be your intracerebral hemorrhage. Okay, so first of all, we are going to draw a very simple diagram so you can understand these epidural hematoma, subdural hematoma, subarachnoid hemorrhage, and intracerebral hemorrhage. So see here, this is our skull bone, one. This is the dura mater. This is the arachnoid matter, and this is your pia mater. Okay, so these three are the meningeal layers of the brain. Okay, and this will be your brain. Okay, so this is your brain. It's covered by the pia mater, then arachnoid mater, dura mater, and the skull. Now we must have to understand that if the bleeding is between the skull and the dura mater here. Okay, so if the bleeding is between the skull and the dura mater, this is known as epidural hematoma. Okay, hematoma, or also known as extradural hematoma. Okay, so this is your epidural space or extradural space. Second layer is dura mater. So under the dura mater will be your subdural space. Okay, it will be your which space? Subdural space. So if the bleeding is okay, so if the bleeding is in the subdural space between the dura mater and the arachnoid mater, or if there is any collection of blood between the dura mater and the arachnoid mater, okay, then it is known as subdural hematoma. It is known as what? Subdural hematoma. Okay, now under the arachnoid mater will be your subarachnoid space. First thing, from your anatomy lecture, you must have to remember that in the subarachnoid space, what is present? Your circle of Willis is present. And second thing, your CSF is present. Okay, so circle of Willis and CSF, it is present in the subarachnoid space. So if bleeding occurs in the subarachnoid space, it is known as subarachnoid hemorrhage. Okay, it is known as what? Subarachnoid hemorrhage. And if the bleeding occurs in the brain, then it is known as intracerebral hemorrhage. Okay, it is known as what? Intracerebral hemorrhage. So how you can understand this? If you understand this diagram, then you are never ever going to mistake. Now see this diagram I have taken directly from the Bailey lab. First thing, whenever patient comes to you with head trauma or injury, investigation of choice is non-contrast CT scan. Okay, non-contrast CT scan. How you are going to know that this is a CT scan? Skull bone will appears white. So if the skull bones appears white, it is your CT scan. If it is not appearing white, other in color, grayish in color, other color, then it is MRI. So this is a CT scan image. Now see here. This is your lens shape density. Okay, so this is your what? Lens shape density. So lens shape density, or you can say it like that, that biconvex or lenticular lesion is seen in patient with what? Epidural hematoma. A, it is your epidural hematoma. Epidural hematoma, please remember, it is mostly arterial and the bleeding is from the middle meningeal artery, which is a branch of your maxillary artery. Okay, middle meningeal artery, which is a branch of your what? Maxillary artery, and this artery is passing through a point known as steroid. Patient will develop lucid interval. Patient will develop what? Lucid interval. Okay, investigation of choice, again it will be the non-contrast CT scan. Okay, and please remember, very important thing, that this bleeding is not going to cross the suture lines. It is not going to cross the suture lines. Okay, now see here, this lesion, it is appearing white on the CT scan. So if it is appearing white on the CT scan, it is known as hyperdense lesion. So please remember, if it is a hyperdense lesion, for example here, it is also a hyperdense lesion. So hyperdense lesion means what? Acute bleeding or fresh bleeding. Okay, acute bleeding. For example, in case of here, for example, this is your epidural hematoma. So this is a hyperdense lesion. So it means acute bleeding. Acute bleeding. Okay. Now see this. This is now not your biconvex lenticular shape lesion. Okay, or not lens shape. So this is your what? This is your which type of lesion? See here. This is your subdural hematoma. So it is not lens shaped. It is your what? It is your what? It is your concavo convex lesion. Okay, it is your what? Concavo convex lesion. Okay, so this is your subdural hematoma. Now see here again this picture. First of all, you all know this is a CT scan. This is a CT scan. Now see here. Okay, see this lesion. So this is lens shaped. So this is your what? Epidural hematoma. This is your what? Concavo convex hyperdense lesion. Concavo convex hyperdense lesion. So this is your what? This is your subdural hematoma. Okay. So what are the important points of subdural hematoma? Number one, it is a collection of blood between what? Between your dura mater and arachnoid matter in which space? Subdural space. Please remember, it will cross the suture lines. See here, epidural hematoma, it is not crossing the suture line. It will cross the suture line. Mostly the patients are alcoholics, old patient, or patients who are on anticoagulants. Now see here, epidural hematoma, it is the middle meningeal artery. But in subdural hematoma, it is your cortical veins or bridging veins. So cortical veins or bridging veins. So it is mainly or more commonly it is venous in nature. Okay. So it can be acute subdural hematoma, subacute subdural hematoma, and chronic subdural hematoma. Less than 3 days acute subdural hematoma, uh, more than 3 to 21 days subacute, and if it is more than 21 days, or 3 weeks, it is your what? It is your chronic subdural hematoma. Now see this picture. So this is your hyperdense lesion. So it means it is an acute bleeding. Acute bleeding. But now see this picture. This is not a hyperdense lesion. Okay, so this is a hypodense lesion. So it means it is an old blood. Okay, old blood. And here it is your hyperdense lesion. So see here, B, bilateral subdural hematoma on the left side. This is the left side, this is the right side. On the left side, hypodense material representing the old blood, and higher density here is indicating more recent bleeding. Okay, which will require what? Craniotomy in the patient. This is a picture of burr hole. Okay, so burr hole or craniotomy you are going to perform in the patient. Okay, so this is a picture of your what? Intracerebral hemorrhage. Okay, so intracerebral hemorrhage or bleeding. This is a picture of your what? Intracerebral hemorrhage. Okay, now see this diagram. This is also your bleeding in the putaminal bleeding. So it is your intracerebral hemorrhage. Lenticulostriatal arteries rupture, which are the branches of your what? Middle cerebral artery. So it is your intracerebral hemorrhage. Okay, now see this diagram. This is once again, this is your CT scan. Okay, and now the blood is filling in the subarachnoid cisternas and into the sylvian fissures. So this sign is known as star of death, and this is seen in patient with what? Subarachnoid hemorrhage. So what are the important points of subarachnoid hemorrhage? Please remember, most common cause is trauma, and second most common cause is your what? Rupture of your Barry's aneurysm in the circle of Willis. Okay, rupture of the Barry's aneurysm. What will be the clinical signs and symptoms in the patient? Worst headache of my life. Worst headache of life. Thunderclap headache. Severe headache. There will be neck stiffness also. Don't confuse it with meningitis. Okay, neck stiffness, severe headache. And when you are going to perform lumbar puncture in the patient, see here, this is a normal CSF. You are going to find what? Xanthochromia in the patient, especially if it is due to the aneurysmal rupture. So this is your what? Star of death. Okay, star of death appearance. What is the investigation of choice? Again, it is non-contrast CT scan. Management is what? Management is mainly your conservatively, but if surgical management is required, then we will go for coiling and clipping. Okay, coiling and clipping. Okay, so these are some of the important points of your one more thing, please remember, in subarachnoid hemorrhage, to prevent vasospasm, drug of choice is nimodipine. This is a very important MCQ which you must have to remember. Okay, so this is your subarachnoid hemorrhage, burr hole, subdural hematoma, epidural hematoma, head trauma. I hope it is clear to all of you. Thank you.